Welcome to the Champions of Active Women podcast. In this podcast, we will interview individuals who have been successful within athletics and beyond. We hope that these interviews will encourage and inspire girls and women to be active for a lifetime, to reach their goals, and to break new barriers in sport and life. This podcast is brought to you by the Active Women's Health Initiative and the Sports Medicine Research Institute at the University of Kentucky. The mission of the Active Women's Health Initiative is to optimize health and promote physical activity and wellness for girls and women across the lifespan. We hope you enjoy our conversations and join us in understanding women's health today to ensure women's health tomorrow. Thank you for joining us for another episode of the Champions of Active Women podcast. I'm Dee Degonsky, your host, and with me today is Dr. Gretchen Wells. Dr. Wells is a cardiologist at the University of Kentucky Medical Center and has been in practice for more than 20 years. She received her medical degree from the University of Alabama at Birmingham Medical School and completed her residency at Wake Forest University, Bowman School of Medicine in Winston-Salem, North Carolina. She then completed a cardiology fellowship also at Wake Forest University. Dr. Wells is the medical director of the Women's Heart Health Program at the UK Gill Heart and Vascular Institute. This program addresses the unique cardiac needs of women with a specially tailored program. This comprehensive approach provides individualized heart care for women by women physicians, nurses, and staff. Dr. Wells is also a member of our Active Women's Health Initiative Advisory Board. So thanks so much for joining me today. I'm really excited to hear about your perspectives on health and activity for women from both your personal and professional experiences.
Thank you for having me.
So could you start by, me too. Could you start by talking about what health means to you?
Oh, health. I think of health as being more of a state than a trait. Physical as well as psychological integrity, if you will, and the ability to do the things that you want to do in your normal life, whatever that is, whether it's taking care of loved ones, employment, enjoying daily activities, travel, whatever.
So that really holistic picture of health.
Yeah. It's more than just the body, and it's more than just absence of disease. It's more about wellness and your ability to do the things you want to do.
Yeah, the old World Health Organization definition of health. I think it's from like the 40s, and it hasn't changed much. But you know, how we think about it sometimes has. But that definition is old and a good one.
Yeah.
So as I mentioned in your bio, you are a cardiologist and the medical director for the Women's Heart Health Program here at UK. Could you talk about how you decided on a career in medicine?
I was exposed to medicine, to science, and really to the entire service industry early in my life. I had physicians, nurses, pharmacists all in my family, and they inspired me, and I was around it. And I took classes in high school, not only in history, but I had a genetics class, and I was inspired by some people who came to visit our school who were medical geneticists, a husband and wife, and I was quite impressed with what they did. And this was a fairly new field at the time, and I continued an interest there throughout college and did a combined program in medical school and enjoyed it. And I always thought I was going to be a pediatrician and started a pediatrics rotation. And I found that it just didn't resonate with me. And I had enjoyed internal medicine, and it was time to do an acting internship. And I left my acting internship from pediatrics. And there was an opening for an acting internship in cardiology. It had already started, in fact, and I joined, and my attending physician was Dr. Jerry Blackwell, who's now, I believe, in Kingsport, Tennessee, and he was one of my early mentors in cardiology, and it just continued to grow. So that is how that happened.
Yeah, so it sounds like somewhat serendipitous, just there was a position open. And did you have any particular interest in cardiology, or it was just?
I didn't know a whole lot. I had done an internal medicine rotation, and it was interesting, but it clicked. It clicked. As I tell people, I'm a hammer and nail kind of person. I like to solve a problem, and we were able to do that in cardiology. But also, as I've matured as a physician, I have realized that most of this is preventable. And in fact, there are papers that would support that that is the case. One of Salem Yousef's classic papers looking into risk factors and population attributable risk for cardiac disease, we find that over 90% of it is entirely preventable if we could control about 10 or 11 risk factors.
Wow.
Yeah.
That's really powerful
Yeah,
and
it is.
crazy knowing how prevalent,
Mm-hmm.
issues with heart health are.
Yes.
Wow.
Yes.
So speaking of heart health, could you talk about the goals for the Women's Heart Health Program?
Yeah, we have some challenges here, particularly in Kentucky, but Kentucky by no means is alone in this, which is that we are seeing an increase in women dying from heart disease. Now, the response from a lot of people would be, "Oh, well, you got to die of something. Sudden death's not a bad way to go." But maybe, when you're into three digits, 100 years old or something, it's not too bad. But we're seeing more young people die, not just have heart attacks, but die of heart disease, and middle-aged women, 40s and their 50s and so on. So we need to reverse that quickly. And we certainly have the ability to do that. So that is one of the goals of our heart health program, is to try to mitigate the cardiac risk. And that is why it's such a good marriage with the Active Women's Health Initiative, because that is one of your goals as well. And we know from the Nurses' Health Study, for example, that physical activity, just brisk walking for half an hour, 5 out of 7 days a week, reduces a woman's risk of a heart attack by 50%. And I always tell women, that's better than any prescription I can give you.
Yeah.
And sadly, we don't have prescription pads anymore, because I used to write that on give people a stack of prescriptions, and that was the one at the top, brisk walking, because it was the most impactful that we could do. But I'm going off on a tangent here. You asked about the goals
The
of our
goals.
program, and it's not only just reducing the risk of heart disease, which remains the leading cause of death for women in Kentucky, but also looking at some niche populations. What we are seeing is that maternal mortality has increased in the United States precipitously over the last few years, and it is due to heart disease. So we have a cardiac disease and pregnancy clinic where we see women who are either at risk for heart disease or already have heart disease, and we want them not only to get through their pregnancy, but this is the time to identify them at risk for heart disease later in life. So that is one. And we also see women who are undergoing chemotherapy for cancers, particularly breast cancer. Some of these medications, the oncologists have been very successful. Over the past few decades, it has changed from a life-terminating disease to a chronic disease, or even a disease where when they initiate chemotherapy, the goal is a cure. Mm-hmm. The catch is some of these medications increase the risk of heart disease significantly. And so we have to follow them fairly closely. And in fact, some of these women, they're more likely to die of heart disease than they are of some of their cancers. So we need to get them in treatment early, because we not only want them to survive their cancer, but we want them to thrive through the rest of their lives.
Yeah,
and they can.
Some really important missions there for women overall, but then some special populations of women as well.
Yes. Yes.
So you mentioned that, a large portion of heart disease is preventable. And you said there were 10 to 11 strategies that we could use. Could you talk about some of those that are most important? And
well, first of all, smoking. That is the one that we can, let's just make that a goal, complete tobacco cessation. And there are several women leaders in the community and at UK as well who are involved in smoking cessation at the state level. So that is but I'm talking about, when I'm with a patient, I'm focused on that one person, not what we're doing at a state
Mm-hmm.
level. But smoking cessation, complete abstinence from tobacco is the first thing that we need to consider and to do. Control of risk factors, diabetes, for example. There are some very effective drugs and very effective lifestyle changes that women can make. Control of cholesterol. We have newer and more effective medications, and blood pressure. But before we leave that topic, I want to explore some that are unique to women, some cardiac risk factors. And a lot of women don't know when they come and see me, oh, I don't have hypertension. I just had it when I was pregnant. Well, every study has now shown that independent of blood pressure, a hypertensive disorder of pregnancy is a risk factor for cardiac disease in these women later in life. Okay. Gestational diabetes and so on. Polycystic ovaries, for example, that is emerging as a risk factor for epicardial disease. So we need to be very clear about what is and is not a risk factor. So those are some that just jump out at me that we can treat.
Great. So
Yeah.
as you think about your patients, and you've worked with a lot over your career, I'm sure, what are some of the common challenges you see with sticking to, particularly the behavioral strategies that people can do? So whether it's smoking cessation or walking or other kinds of activity or eating more healthfully, what are the biggest challenges that people face with sticking to those kinds of behaviors?
It's the same challenges that you and I both have, which is there are only 24 hours in a day. The one reason that I hear from most patients about not eating healthy, not exercising is I don't have time. And when I was in my training, I'll never forget, there was a lecture I went to at the American Heart Association, and it was a neurologist. I wish I could remember her name, but she was a very powerful speaker. And she starts off saying, what do you, Bill Clinton, and Mother Teresa all have in common? You should have heard some of these answers. They were all wrong. But the answer was, we all have 24 hours in a day. Mm-hmm. And so it's how we choose to use that time. And we're fortunate in our program. We've had both an exercise physiologist as part of our team, as well as a nutritionist, who were able to work with patients. And these people have jobs as well, and they have other responsibilities, family responsibilities, things that we all have to help us have healthy meal preparation. There are alternatives out there, and they all don't cost an arm and a leg, and have healthy exercise habits. And this is also important because I know that the Active Women's Health Initiative has this interesting Girls Can program, which I would love to hear more about that. But it's so important that our children see what we do. We can't tell them what to do. They're going to do what they see, not what they hear. So working with individuals and coming up with ways to get them to exercise and to move is important. And again, the most common reason we hear is, I don't have time.
Yeah.
And I would argue you don't have time not to.
Yeah, and that's a good argument.
Yeah.
But sometimes people even know that, right? They know that it's really important. They know they don't have time not to. But do you or any of your staff members or other clinicians, do you have special tips or strategies that you give people to help prioritize physical activity and other health behaviors?
I have to tell them what I've done in my own life, because I would be hypocritical if I've told you that all of my life I've exercised and eaten healthy. I have not. I have been down the road and I've said the same things that some of these women have said to me. And what I had to learn is to get up very early in the morning and prioritize the workout. Now, I know that doesn't work for everyone. I know it doesn't. But usually you can find something that will work. And I have some patients who are young mothers, and even having a babysitting circle where this mom's going to work out at this time while this one does. I mean, you can find a way, and
Mm-hmm.
you would be surprised at how creative some people are to make things happen, but they do make it happen. And the walking strollers, being outdoors with the children, there are lots of things to do. And then some people say, oh, we like to watch TV. And so they get a rowing machine, and couples, I have one couple that they're retired, but they have two rowing machines and they row and watch the TV together. So you
Mm-hmm.
can find a way to make these things work.
Yeah.
And some of them are very cost effective. You can get these very cheaply, particularly used.
Mm-hmm.
Yeah.
So you just started to share a few stories of patients who you've worked with, and
Oh, yeah.
kind of the impact that they've had or changes they've made. Do you have a favorite or a couple favorite memorable experiences watching patients change their behavior or improve under your care?
There is one in particular. Um, I would probably even be able to share her name because she is very open about the story, but this is a patient I had in my previous practice in North Carolina. She was a cardiac sonographer, and she had just had her second child. She was extremely overweight. In fact, she was morbidly obese. Her BMI was over 40. She could not walk across the room without becoming short of breath. She had metabolic syndrome, meaning her waist circumference was very high. Her HDL, her good cholesterol, was very low. She wasn't technically hypertensive, but her blood pressure was high, and so on. And she said, I really don't want to take medicines. And I said, you don't have to. I mean, you can change your lifestyle. And what's the old saying? The convert sings loudest at church. She's now an Ironwoman triathlete, and she herself
Oh.
is a coach. And she still works as a sonographer, and I've run into her occasionally and connect with her, but she has done very well. She just made up her mind that she was going to do it. She had no support from outside of her immediate family. She was from California, and she just through sheer grit and determination, taking her lunch breaks, going on walks. And if the weather was bad, she walked up and down the stairs in the hospital, which was 12 or 13 stories. But believe me, she got it in, and she did it. It took her a while, but every day was a commitment. And there was one book, there was something that really impacted her. I wish I'd remember the name of this book, but John Bingham, I believe, who is a runner who shared a story similar to hers, which I believe the title of the book was The Courage to Start. And it just takes a commitment and a decision and some education. So, and there are so many resources out there on the internet that are quite good for patients. And the American College of Cardiology has a CardioSmart application, and it's free. So there are many things that we can offer our patients.
I love that story, and
Mm-hmm.
she sounds like she would be a great podcast episode also.
I'll ask. Yeah,
Yeah,
you would love it. Yeah, she would love it. Yeah.
very nice.
Mm-hmm.
And I'm sure you have many more, but that was an excellent one to
Yes.
share.
Mm-hmm.
So as you know, and one of our goals as the Active Women's Health Initiative is
Mm-hmm.
to encourage and support women as they engage in active pursuits. Could you share with us some of the ways you like to be active?
Yeah, I enjoy running. I'm very slow, but you can do it anywhere you want. You know, when we travel, all you need are a pair of running shoes and you go.
Mm-hmm.
Walking, I enjoy. Now, I used to enjoy swimming, but that didn't work with my time schedule. As a physician, the pools would not open till what I consider later in the morning, but I
Mm-hmm.
couldn't go there and get a swim in and then go to work. So I started running. But I'm sure as an exercise physiologist, you know the answer to this, but I remember being at a meeting in Australia with my husband, a physical therapist, and one of them asked, what is the best exercise for you? And my husband looks at me and said, what is the best? What is it? And I said, the one that you will do. And that's exactly
absolutely
what
right.
the
Yeah.
answer was. Yeah. So even though I enjoy running, and just about every town, city, any place you can go has a running club for runners of different speeds, and you hold each other accountable. I now don't always run with a group, but it's quite fun and enjoyable and social. But that's what I do, and I go very early in the morning, and you feel like when you get in from, or at least when I get in from my run, I have at least accomplished something.
Mm-hmm.
But like I said earlier, walking is about the best thing there is. We have great places in Lexington, the Arboretum, and so on, to go walking, and it's safe.
I'm wondering with walking, I've heard from women in particular that sometimes they're resistant to the idea of walking as a form of exercise. Like it doesn't seem like exercise because it's just walking. Do you ever encounter that kind of attitude?
Rarely.
Huh,
And
that's good. I'm
that's
glad.
probably because of the patient population that I see. They're fairly deconditioned when they've had a cardiac event. So no, that has not been a problem.
Well, that's good because I think I agree with you that it's one of the best things we can do is just encourage
Yes.
people to walk because it's easy and anyone can do it. So
Yeah.
it's great.
And some of the women after a heart attack, for example, if I tell them to walk 30 minutes, they know they can't do it. So
Mm-hmm.
it's something that they can build up to, and they can monitor their progress. And there are some people that love data. They can measure their steps and they can measure their improvement. So it becomes a challenge for them. So that's a great idea
Mm-hmm.
to constantly improve your walk time, how many steps, where you go. And then some people decide they're going to take walking vacations for people who are able to do that. And it becomes quite pleasurable.
Yeah. So thinking about your own activity, you mentioned
Mm-hmm.
earlier that you haven't always been the model example
Mm-hmm.
and
Yeah.
that you have challenges with maintaining an active lifestyle too. Could you talk about some of those challenges or maybe a time in your life when you weren't as active and how you got back to your active lifestyle?
Yeah. Well, when I was in medical school, I was not active at all. Um, and it was only when I was doing a cardiology fellowship that I picked up my activity again and started to eat healthy, because that was when I saw, whoa, this really does matter.
Mm-hmm.
You are what you eat. And that was quite important for me. Um, and I made it a priority, but I just did not make it a priority when I was in medical school. I didn't think I was all that important. There were a few times when I would go to they had a gym there on campus and swim a few laps, but I was not consistent with it. But only when I made it a habit and had a dedicated time that it became something that I did every day. And now if I don't do it, I really miss it.
Mm-hmm.
Miss it.
Beyond just the health benefits, obviously you of all people know the health benefits of being active, but beyond the physical health benefits, what are some of the other reasons that you enjoy being active?
Oh, it's very relaxing for me. It's clears my mind. It gives me time to think. A lot of women like to have that time alone, and I tend to be an introvert, so I enjoy that.
Mm-hmm.
And, yeah,
I'm in that camp too.
yeah,
It's
mm-hmm.
one of the times of the day when I feel like I can be by myself and I count walking the dog by myself too, because she listens well without talking back.
Yeah,
So,
okay, that's great. Yeah, that's great.
so what advice do you have for women about being active and about improving their heart health?
Exactly what I'd said earlier, which is it is so important to be active. We know from the Nurses' Health Study, which was a longitudinal study of women over decades, that those who are active had the best outcome. We also know that if you have had a cardiac event, cardiac rehab, for example, which one of the components is exercise and activity, that there is a distinct mortality benefit in patients who participate in that program. So when I say your life depends on it, I'm not being dramatic. It does with activity. And as you age, this is particularly important because you have the risk of frailty and so on. And I want to keep people alive, not just to keep them alive, but so they can enjoy their lives. Mm-hmm. And that is why I support activity as well as primary prevention of heart disease. I tell people it's my goal to keep them out of the cath lab. I don't go there, and I don't want you to go there either. Mm-hmm. Yeah.
So is there anything else you'd like to share with our audience today?
No, just thank you very much for having me. And the work that you all are doing is so important in our community. And I would just love to see it grow, and hopefully we can continue to collaborate.
Absolutely. And
program.
I appreciate your time today.
Okay, thank you very much.
Thank you for listening to the Champions of Active Women podcast. This podcast is brought to you by the Active Women's Health Initiative and was produced by the Faculty Media Depot at the University of Kentucky. If you enjoyed this episode, you can listen and subscribe to all of our episodes wherever you find your podcasts. For up-to-date information about the Active Women's Health Initiative, you can find us on social media at UKAWHI. Thank you for supporting us as we work to promote health and physical activity among girls and women across the lifespan.